You're watching Cetome TV. Knowledge is power.
So first off, there's low grade. So today we're going to talk about low grade serous,
Okay.
mucinous, and then high grade serous.
Okay.
And high grade serous is really the one that needs the most conversation on because it's the most common and it's it can be a very deadly disease.
Okay. So we're going to look at 3 types of ovarian cancer today.
And we're going to focus on high grade.
Okay.
So low grade typically arises in the ovaries, and this is important, and I'll discuss that why later. But it typically arises in the ovaries. It's basically believed to be a slow growing, and because it's slow growing, it has a poor response to chemotherapy, standard chemotherapy. And the reason is because standard chemotherapy affects rapidly reproducing cells. So a cell line that's slow growing is going to have less of response. And I've seen reports as low as a 3 to 4% response to standard chemotherapy. Typical genes that are involved in this, which can be used for targeted therapies, are the KRAS, BRAF V600, which is common to melanoma. And MEK inhibitors are starting to be used in these too.
Okay.
So after that, they seem to be, most cases of low grade seem to be fairly responsive to aromatase inhibitors. And that's because they are an estrogen-based cancer.
Okay, and tell us a little bit about aromatase inhibitors.
Well, they're used for breast cancer.
Used for breast cancer. You tell me that like I should know that, but you're the cancer guy. I am not the cancer guy. Okay.
Sorry.
Okay, thank you.
Then there's mucinous. And mucinous, as it may sound, is a mucus-based from the mucus-producing glands. It arises from typically benign or borderline precursors in the ovaries. Also comes from the ovaries.
Okay.
It's also not very responsive to chemotherapy. Typical mutations are P53 gene. There's an applicon in this region of the genome called the chromosome 9p13. And then there's a lot of what we call copy number variation in mucinous. And copy number variation is where you have multiple copies of certain genes. Typically, these genes are going to be not tumor suppressor genes. They'll be, pro-cancerous genes and metabolic genes.
Oncogenes.
Oncogenes, yes. Yeah, in general.
Okay. All right.
Yeah. So typical mutations to look for are signaling in the Wnt pathway.
Okay.
And then they're also looking at RAS and RAF inhibitors for these.
Okay. And this would be, in order to be able to tell if the Wnt pathway was involved or RAS or RAF, you need genetic testing.
Genetic testing for all ovarian cancers,
right,
to determine exactly what type you have more specifically.
Variance.
It's way too much variance.
Right.
Yes.
And the treatments differ.
Yeah, especially when you have a cancer that's not going to respond to chemotherapy, you need to rely on targeted therapies. So very, very important. And once again, if you have a disease that's not going to respond well to chemotherapy, it's really important you know all of your treatment options.
Like the low grade, you were saying earlier, the low grade serous, because it's so slow growing and chemotherapy, it depends on your cancer cells being rapidly reproducing in order to find them and wipe them out. Chemotherapy wouldn't be so great for them.
Yes.
Yeah. Okay. All right.
So we're going to go into high grade serous now.
Okay. Sounds good.
So high grade serous, which is the most common and, probably the most deadliest.
Most common, huh?
Yeah.
Okay.
It occurs from what's called the serous epithelial layer in the abdominal pelvic cavity.
So not the ovaries.
Not the ovaries.
Okay.
It was, for a long time, it was thought to have started in the ovaries and to stay in the ovaries and, basically spread out from there.
Okay.
But now this layer, the serous epithelial layer, is very common in the ovaries. And that's why, they assume that it started there, and that's where it grows. So that's definitely where it grows.
Okay.
What we know now is that it originates in the fallopian tubes.
Okay.
And this is very important.
Okay.
So the fallopian tubes have this area called the transition zone, where these stem cells that repopulate these areas exist. And so these cancers actually start there. And this has been a big problem because for many years, if someone had a low grade, a high grade but low stage form of serous, they would take out their ovaries and they'd leave in the fallopian tubes and everything else.
Yes.
Then the cancer would inevitably come back.
Right. Because it was growing in the fallopian tubes.
Exactly.
And
so there was a study done by some BC cancer scientists, I believe. What they did was they looked at how, removing everything, having what's called a full radical hysterectomy or oophorectomy, yes. Having everything taken out really reduced the chances of this disease coming back if it had not metastasized already significantly, and even leaving in, little bits of tissue, almost guaranteed it would come back.
Wow.
It was significant rates.
Wow.
So, knowing the origin is very important.
Yes, right. Because if you were thinking it was the ovaries, you'd think, oh, if I take those out, I'm going to be fine. And yet, not so much.
Exactly.
Right. Yes. Okay. So this is for the high-grade serous.
Yes, it's high-grade
which, as
from
you
now
say,
on.
is the most common and most deadly.
Yes.
So generally, the advice now is
take everything out. Don't even
have
take a
nice
chance.
thorough...
And we still see cases where doctors are not doing that. They don't have this information, and this information's been around for a long time. So make sure your doctor knows about it. We do. Up until I think last year, I saw a case where they didn't take it all out.
Wow.
So definitely.
Thank you for watching Ketome TV. Subscribe below and stay informed.